For this injection, the following armamentarium will be needed: a yellow cassette with a mouth mirror and cotton pliers, a needle capper, a syringe, 2x2 cotton gauze, 27 gauge short selection, a cartridge with solution appropriate for the patient with or without epinephrine, 20% benzocaine topical anesthetic, and optional Q-tips. For administering this block, the cartridge must be loaded with the top portion in first. Be sure that the barcode is pointed away from the large window and the clinician is able to clearly read the information printed on the cartridge through the large window. Provide one strong twist of the syringe so that the harpoon is engaged, and never pop the harpoon with the palm of your hand. Check that the harpoon is engaged by carefully pulling back slightly on the thumb ring. Carefully twist off the bottom portion of the needle and attach it to the head of the syringe. Twist the needle into place until snug. Be aware of bevel placement for your specific injection. For the PSA block, the nerve anesthetized is the posterior superior alveolar nerve. The landmarks for the PSA are the maxillary tuberosity, the maxillary mucobuccal fold, the maxillary second molar, maxillary occlusal plane, and the mid-sagittal plane. For the PSA, the areas anesthetized will be the maxillary molars in 72% of the cases. The mesiobuccal root of the maxillary first molar will not be anesthetized in 28% of the cases, as well as the buccal periodontium and the gingiva of the anesthetized teeth. At this point, apply the 20% benzocaine topical anesthetic to your insertion point. The proper PSA angulation should look similar to a laser pointed to the crown of the head. For this specific injection, we will be using a 27 gauge short selection and administering 0.9 to 1.8 milliliters of solution at a depth of 16 millimeters. The point of insertion for the PSA will be at the height of the maxillary mucobuccal fold at the apex of the maxillary second molar, distal to the zygomatic process. We will be aspirating 3 times. For the PSA block, you will be administering 0.9 to 1.8 milliliters of solution, which will look like this. Be sure to thoroughly rinse your patient and dispose of the needle and cartridge in their respective bins. Let your patient know where they should be expecting numbness to occur. Post-operative instructions should be provided to the patient by the clinician, such as, while numb, please be careful not to bite your lip, cheek, or tongue. No hot temperature food or beverages, no crunchy foods. Please stick to a soft food diet until the numbness wears off.